while you're all sitting or getting placed, each of you has probably made a remark that has prompted a possible response from one of the other speakers. And I'd like to offer each of you an opportunity, if you want to take it, to either explore further or maybe challenge something that one of your colleague speakers here has provided. So let me start with you, Duffy, and see if you had anything you wanted to comment on.
I'll just comment just to clarify, this is a little off topic, but the third-party certifications, I don't know if that was clarified very well. You'll see that some companies will carry a seal on their product, whether it be a USP seal or NSF seal. And I just want to clarify that we've talked a lot about the regulations and FDA doing good manufacturing inspections and testing products, but we know they have limited resources. So what companies do to ensure to their consumers that there is someone looking over their shoulder and checking, they invest in these third-party seals where another organization will come, do an inspection, and see if they meet their standard and put a seal on the bottle. So one of the familiar ones you'll see in advertisements is the USP seal. So I just wanted to clarify what that means for people. So if someone is distrusting to a company, you can feel confident that there's an independent body looking over their shoulder doing an evaluation.
Okay. Laura, did you have anything you wanted to comment on? Okay. James?
I guess going off of the good-bad swing, too, of why we get into that cycle, I think there's a lot of forces in social media, too, that are pushing us that way in politics as well. Obviously, we know we respond to strong things. We respond to something that is either a miracle cure or that is causing cancer in all of us. And the in-between is much, much harder to communicate, and we know that's where most of the effects we're dealing with are. So, if anyone has found great ways to communicate, to get people interested in the nuance, or to write for mass audiences and say this is going to be sort of good for some of you and sort of bad for others of you, and have that be the takeaway of a story, that's really difficult when you're doing like news you can use sort of stuff, which I don't have to do quite so much, but other people who work in health information, that's the challenge. That's the constant challenge.
I think that's a challenge that we face in trying to help people to understand the balance of information and not get too swayed by one set of data or another, both of which might have been based on the same original data set, by the way, just exquisitely massaged in very different ways. Tod?
I don't have a comment on anything said by the others. Just one general point, just in terms of interpreting, results, because we do that at Consumer. We're poring over the latest studies regarding supplements, and I think it's a shame. I think that many in the medical community have come to see vitamins as drugs. And so, it's like I can almost predict every vitamin D study I see that comes out. If you're giving it to people who already have a blood level of over about 20 nanograms per deciliter, it's not going to do much. And then the study's going to come out and say vitamin D doesn't work. And then they give it to people, in England, who get no sun, and they have a level of 15, and it's curing asthma, and respiratory conditions. So it would be nice to see more thought to those issues, because it makes it very difficult for us. There was a study that came out this week or last week, the one showing that folic acid actually reduces the risk of stroke. However, when you look deeply into that one, it was based on the study in China where they don't fortify with folic acid, so it helps in China, and it doesn't necessarily always help here. So, those are the kinds of things you wrestle with, I'm sure, as a journalist, and we all have to wrestle with.
Yeah, well, thanks for that observation. Laura, did you have anything you wanted to comment on?
Also, I was winding up to my big finish.
Sorry.
That's fine. So I do think there are particular things that we should do better to figure out how to get away from an addiction to man bites dog clickbait right? We need to bring greater levels of skepticism to headlines and news coverage, because a lot of health coverage, not the Atlantic, but other sources are driven by the unexpected finding, the surprise contrarian view, et cetera. That's what makes the structure of news, and it's very tempting, but it means that people are confused on the whole, that there is a lot of noise in the marketplace that's open to exploitation, and it does have concrete health consequences, because people are able to then, because the manufacturing and the branding of foods is then able to lock into these pre-existing kind of psychological landscape where we're capable of being misled. And so I think better science education and really a discussion about ethical norms in science or in medicine, is timely. Ethics conversations among journalists about how do you provide the necessary context, even in a landscape that might be sort of boring in this sort of news environment. Disclosure of funding and of other sources of bias when research is conducted. And making it searchable and sortable so that you know at a glance from the abstract of the study online who was the funder, what was the entanglements there, and then just more public education about skepticism and deeper grounding in sort of scientific norms. That seems to me really important. My daughter's going to grow up in an environment that's even noisier than this one. And we need to start talking about these things now, because we need to be able to continue to publish complicated, nuanced stories that say, 7 out of 8 of these studies were robust enough to make a concrete finding and they found no effect. And we need to have a population of people who can receive that kind of information and understand what it means in context.
Good, thank you very much. Merle?
Thank you very much. So what I hear from my colleagues here is it's essential for us all to maintain this focus to detail, this commitment to being as informative as possible, to avoiding anything that people might find misleading, and all these things together are a clear path we can look at, which will lead us to great outcomes in the future, I think. So just wanted to offer my appreciation for all of you here, coming down to the event, for our organizers, getting us all at the same table, getting us in a conversation together. So thank you very much.
So let me just see now if there are some comments or questions that members of the audience have.
Hi, yeah, Dr. Hamblin. I see here that the Atlantic is hosting an event in Chicago tomorrow called A New Frontier of Biosimilars in Cancer Care. Can you comment on the role of the Atlantic in supporting research and dissemination of research to the public?
That would probably be an Atlantic live event. Oh, okay. Yeah, so there's live events are something that is a journalistic bringing together of doing live interviews. We don't actually support research.
You're putting everybody together to make the conversation happen.
Yeah, it's sort of bringing together for live conversations in the same way that might happen on a talk show on PBS or on public radio, but it's happening in a live event, which is a growing area of interest in journalism. I think probably a reaction to this like clickbait saturated market and people feeling like they're isolated in echo chambers where we can actually have people come together and sit down live. They're pretty small events, but you get, 100 stakeholders together to actually have a conversation in person, which is cool. My role there is usually moderating.
Sounds like a dietary supplement research practicum to me.
It very much does.
There was a question at the back, and then Reagan, and then Joe.
Hi, this is a really great session, and I always enjoy hearing all of your points of view. I've heard some criticism that the industry doesn't do research studies, and then we've also heard criticism that we have to be skeptical of industry-funded research. So I'm just wondering if there's a way that we can have partnerships, or if you envision any tips or tricks on how to make things work better than they have been.
While you're thinking about it, I'm going to weigh in on that one because partnerships do, of course, exist specifically over research. Example, the VITAL trial that is currently being run from Brigham and Women's Hospital multi-center clinical trial relied on companies to provide active ingredient and placebo, no cost. So that's a way of participating in the research. It's clear what the roles and responsibilities are of the public and the private sector component, but there's an example of a partnership. So that was my take on it. What else would you like to offer?
So I'll comment because I spent part of my career in academics. So I was on the receiving end of funding, and I've spent a good part of my career in industry funding clinical trials. And up front, I think it's really important for the funder to specify with the person who's actually conducting the research, what are the rules of the road? And in some cases, we've simply given grants and said, this is your money, you do with it what you want, and we have no involvement whatsoever in the trial. In other cases where we had a lot of knowledge in that particular area, we would be co-authors with the person who is conducting the research. But I think if you're really clear up front, I think we can have really good clinical trials that don't have industry bias. And there is industry bias, but there's also academic bias, and I think we have to all be really clear about what our expectations are up front.
Other comments on this particular question from members here?
I think it's reasonable to both require proof of effectiveness in actual scientific studies and also to require transparency around the funding of those studies. I don't see the conflict. You know, you can evaluate the findings of the study and its robustness with adequate transparency, and you need both things to happen.
Well, I do know there's a lot of readers who will just immediately write off something that's industry funded, and it's easy to write in a tweet. If there is some new study that says sugar isn't as bad as we thought, if Coke has its name anywhere on that, it will be immediately written off. And the newspaper will be seen as a sucker for even publishing it. And I mean, I'm not saying that that's bad that we've swung that far in that direction. But I think there can be industry-funded research that's good. It's just really hard to communicate. Okay, there is this conflict. You should be aware of the funding source, but also the methodology looks pretty good. So take that for what you will.
Okay.
I just would say those readers are applying like a plausibility analysis. You know, if it's Coca-Cola and it's a study about the outcomes of sugar and it runs contrary to everything that's been found, it's not an unreasonable conclusion.
No, sure.
Right.
Yeah, and I would just add, as someone mentioned earlier, just seeing it that a trial was registered at clinicaltrials.gov, is certainly a boost, even if it is industry sponsored.
There comes an obligation with submitting protocols to clinicaltrials.gov, and that is that the data be made available after the trial has been finished in some reasonable lifetime.
I think this is a salient issue because the landscape I'm seeing is that the government's not handing out significantly more and more amounts of money in the future, or at least the near future. And we are going to be reliant, if we want claims, we want substantiation from claims, someone's going to have to pay for that evidence. And if you want the evidence to be specific towards the product and how the product is made and how the product is formulated, there's not a lot of people jumping up and down to pay for those studies other than the person who's going to sell the product. And that's why we have consort guidelines in clinical trials, and that's why we have clinicaltrials.gov, so that we can put this information out and it can be judged fairly. The challenge is, and it's going to take years, is everyone's just suspicious. And like you said, I think we're in an environment where you connect the industry funding and people just dismiss it. And that is, it's a problem for everyone. It's not just a problem for industry, it's a problem for future researchers, it's a problem for people who are supportive of additional science and additional scientific studies. And the companies that we work with, they go to a lot of risk a lot of times when they invest in studies, because the principal investigators, they're not pushovers. They're saying, I'll take your money, but I'm in control of the study, I'm in control of what it's published. You know, there's a lot of checks and balances in that process.
Joe, you had a comment, and then Howie.
Yeah, James, I'm sorry to pick on you, but you're the journalist up there, so. Having been subjected to interviews on science papers in the past, my general impression is that there's quite a lot driving journalism that's based on press releases. University will put out a press release. The journalist will interview the principal investigator, perhaps some other interested parties, stakeholders. What percentage of the journalists actually go read and understand the study? Not the abstract, but the full study.
Yeah, actually, there are so many new, small VC-funded journalistic sort of click websites which are trying to do the truth, but are also asking young journalists to write 4 posts a day and across something they don't know a lot about, and so it's really, really common for them to quote a press release or just read the abstract. It's much more rare for someone who can dig into the methodology and is given the time to. And so, you know, to hire someone who has the background to be able to do that, and then to give them the time to do that, and then to go also interview people who are expert who had nothing to do with this study. You know, when you read all that, that means you should. The best answer is to support that journalistic outlet, and that's not just a plug for the Atlantic, like whatever one you like reading, but that costs money to do, and it is the result of all these people who thought they were going to disrupt the journalism industry by having people just post 5 posts a day, who then really watered down the quality and sort of led to all the sorts of things you're describing. So we need good journalism.
Any other comments from people on the panel about this issue? Howie.
Yes, I have a brief comment, a quick survey question, and then another question. First of all, I think science has changed dramatically over the last 2 decades in the way that it's presented. So if you look at journal articles, for example, they're shorter and shorter on average. In addition, there's been a proliferation of online journals that have really diluted the talent pool, if you will, of papers that are coming out and being peer-reviewed, if at all. And a lot of those do involve supplement studies. It's very easy to kind of grab data, do meta-analyses, and kind of generate headlines, if you will. And the news cycle is much quicker. It used to be about a week. Now it's about barely 24 hours. And I think that in light of the previous comments about conflict of interest, it's a very easy way for a lot of the work that a lot of people are doing with good intentions. Without the transparency, the whole key is transparency of process all the way through. That whatever your funding source is, it is what it is. You state it up front. And ideally, if there is industry support of a trial or analyses that are being done, the whole key to me is that it needs to be investigator initiated. Without that, I think it really kind of sullies the science. So that's a brief comment. Then my second one is a quick survey. I'm not sure if this was done yesterday because I wasn't here, but quick show of hands. I'm going to pretend we're doing a mini study. How many people here have taken any supplement in the last 4 weeks? Doesn't matter what or anything. So interestingly, if you look at the table there, and this is not to highlight specific participants in this mini study, it was 3 and 3 if you had noticed. So we all carry certain biases toward how we view dietary supplements. And no matter what your perspective is, I think the whole key is to try and be as agnostic to that process as possible. A lot of us are taking them in some capacity, and how we take them, how we interpret it's incredibly important.
Just a minute.
Sorry.
You didn't answer your own question since
My hand was down, so my hand was down. Sorry. When I hit 50 in a few years, then I might be rethinking that question. So, but then back to a question. So, you know, one thing that's been incredibly important to me is trying to figure out ways that we could be a little bit more innovative in how we approach research on all levels. It's not just the big trials that I've been involved in, but all levels of research, and trying to create more partnerships and continuity and consistency with methodology, how the funding sources might be, whether it's NIH or industry or other nonprofits. I'd love to hear from the panel, all of you in aggregate in some way, just about how we can maybe try and change our approach toward research of dietary supplements to make it a little bit more transparent, a little bit more reliable, and also how we can ensure that we avoid what I always like to call the Dr. Oz effect, where things get sensationalized and marginalized, but yet still reach a very large segment of the population that ends up turning into misinformation.
Just so one thing is the importance of when a study is done with a supplement to know that the supplement was actually analyzed, to know what was really in that supplement. It used to be that you'd rarely see that. I know you've been putting a lot of pressure on investigators to do that, but I still see a product. There was a study that came out just this week with probiotic, had an amazing impact. It was done down in Baltimore on people with mania who had just been hospitalized, and they were the rate of rehospitalization was so low if they were given a probiotic versus not given a probiotic. It was dramatic. But they didn't really characterize what was in the probiotic. I've written to the investigators to find out what's in the probiotic, but you'd think, and this got a lot of coverage as well, this study. So that's just one thing, is just making sure we know that what was actually tested.
I think in that regard, I'll just jump in for a second, Duffy. In that regard, ODS's work is not done yet. Then if we keep pressing to ensure that quality research is done with quality and well-characterized products.
And to build on that idea, there's one provision in the regulation for new ingredients that have been entered the market after 1994. You have to commit to FDA a dossier within 75 that establishes the ingredient safe. This is nuanced, but it's the new dietary ingredient notification. It's a robust process. It costs $500,000 if you have a unique ingredient. One of the things we're working on is working with FDA to do some intellectual property protection. So for those people who choose to go through the new dietary ingredient process, they get no objection for FDA, they get their new dietary ingredient on the market, they have some intellectual property protection, so it motivates them to build a scientific dossier on that specific well-characterized ingredient as opposed to a commodity ingredient. Right now what's happening is big company does all the science, ingredient gets out there, and then other companies see success and they'll sell a similar ingredient and call it the same. And so what we need is to reward that specificity for science-based companies.
Yeah, I would add actually with CBD, because you're hearing it a lot about CBD now, which is why we tested it. So it is going to be approved this year as a drug, CBD. And if the company didn't feel that they would, there'd be a reward for that, they wouldn't have done the research. Interestingly, just so you know, the CBD that's being approved, will be approved probably, has hundreds of milligrams of CBD. The CBD oils that you see out there typically have single digits, maybe 10, milligrams. No evidence that that's really going to be effective.
Merle, you had your...
To clarify,
yes.
though, we're not talking about supplements, just for the record.
Because they're my understanding is because CBD is actually being under an IND, it's being investigated as a drug, it can't be sold as a supplement, which is a weird rule, but in any event, that's, I believe, where things stand.
I believe there are details to the new dietary ingredient process with relation to INDs, but to try to stay on the subject of ways to do better studies and ways to excel, I think events like this where you can get together with folks who have conducted exemplary studies, where we have opportunities to socialize and engage with each other during breaks and to meet with people who have different points of view, are a really valuable part of being able to take research to the next level.
Are there other questions from the audience? Naresh?
The food allergy is very common, and same may hold true for dietary supplements as well. I don't think anybody talked about it at all. Idiosyncratic reactions are very common. I think our colleague mentioned about it. Any ideas, any thought about it? Any suggestions?
Did you say food allergy?
Yeah, food allergies and dietary supplement allergies and...
So the same regulations apply to dietary supplements to food. We have to comply with FALCPA, the Federal Consumer Protection Act. So we have to label the 8 major allergens, plus we have to be compliant with the gluten-free labeling regulations. and then soon the bioengineering. So we're on the same page with all other food. If you have issues with how food allergies are addressed in the United States, you have to address it from all the commodity categories together. I don't know if that hits.
So if I could also jump in on that one with respect to allergens, I think we have a wonderful opportunity here with our journalist to remind consumers that dietary supplements are foods. Foods occasionally have these idiosyncratic reactions, to maybe look at some of the recommendations we heard yesterday with adverse events also today, possibly discontinuing use, talking to someone with expertise might be a good reminder to occasionally put in front of the public.
Mary?
So, as someone who's looked at a lot of adverse event reports, and I sense that you're not just asking me about food allergies like peanuts, wheat, corn, soy, I forget what the other ones are. Anyway, so the most often that this has shown up in the literature, again, is adverse event reports, and it's reported generally as a cross-reactivity in the Compositae family. So if you're allergic to anything that looks like a daisy, so you're allergic to chamomile, don't eat a Ricola mint because there are things in there that might cross-react. There's theoretically, you could cross-react, for example, with echinacea, etc. But it really hasn't been a large part of the adverse event reporting, this idiosyncratic allergic events, particularly. Just that one thing in the Compositae family with cross-reactivity, and that's very uncommon, and the reactions are generally not life-threatening, like
Okay,
tree
that's helpful.
allergies are, tree nut allergies are.
So I'm going to close this out now. I think this has been a vibrant and useful discussion. I want to do two things. And the first is to thank our panel members once again, especially for their tolerance and their enthusiasm, their willingness to address questions from one another and from the audience. So please join me in thanking them.